Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Today we will be studying about the lung tumors, and from lung tumors you will be getting a short note. Okay, let's start. What are lung tumors? Lung tumors are basically an abnormal proliferation of cells within the lung parenchyma. In the lungs, you have the parenchyma, so they are the abnormal growth or the abnormal proliferation that is present in your lung parenchyma. They may be benign or they may be malignant, but you know what? 95% of them are carcinomas. What is the clinical importance? They are the leading cause of cancer related to the death worldwide. They are frequently detected late due to the absence of symptoms. The patient does not present with the symptoms. We are not able to diagnose the patient on time. That is why, right? If I talk about the epidemiology, incidences accounts for the more than or equal to 1.8 million deaths annually. Deaths are more than breast, colon and prostate cancers. Peak at the age of 55 to 70 years. What is the etiology and risk factors? Are very famous. Cigarette smoking. Then occupational exposure. Mainly due to arsenic, chromium, nickel and silica. And you also have the radiation exposure. Let's talk about the pathogenesis. So in the pathogenesis, you first have the adenocarcinoma, and in that you need to remember the MET and RET gene and KRAS gene mutation. In the squamous cell carcinoma, you have the loss of p53 gene mutation. And guys, we have read about the gene mutations in our journal pathology lectures. If you are not aware, if you are struggling with the gene mutations, please watch that video. In the small cell carcinoma, there will be inactivations of TP53. There will be field cancerization, that is smoking will lead to multiple independent areas, dysplasia and carcinoma in situ, which will further leads to the multifocal tumors. For the classification, you have the non-small cell carcinomas, adenocarcinomas, that is most common especially in women and who are non-smokers. Then you have squamous cell carcinoma, which is strong link with the smoking, okay, and it is central. Then you have the large cell carcinoma, poorly differentiated and aggressive. Then you have the small lung cell carcinoma, which is highly malignant. So what are the secondary tumors you have? You have lung is the most common site for secondary metastasis. What is the sources? You have the breast, colon, kidney, pancreas, thyroid and melanoma. These are basically the sources, and you will be having appearance called as a cannonball nodules. You have the appearance called as the cannonball nodules. In the morphology, you have central and peripheral. In the central one, you will be able to see that the central one are more commonly seen with the squamous cell, and you will be able to see the presence of obstruction will be there. In the peripheral one, there will be the presence of large cell carcinoma and adenocarcinoma. What are the microscopic feature in the squamous cell? You will be able to see a keratin-pearl. This is like a keratin pearl. Okay. In the adenocarcinoma, you will be able to see that there is glandular formation. In the large cell, you will be able to see the undifferentiated malignant cells will be there. And in the small cells, you will be able to see that there will be small round blue cells will be there. What is the clinical feature? You will be having persistent cough, 𝗵𝗵𝗵𝗵, and chest pain, dyspnea and wheeze will be there. Regional spread will be there. The person will have the pleural effusion. There will be hoarseness of voice. That will be there. Dysphagia will be there. And phrenic nerve palsy and phrenic nerve palsy will also be there. There will be superior vena cava syndrome. That is, the patient will say that, doctor, I'm having, you will be able to appreciate also that the patient is having the facial swelling. Then you have the Pancoast tumor. What are the distant metastases? Like if the distant metastasis happens in the brain, there will be the clinical features of seizures, focal nuclear deficits. In the bone, there will be pathological fracture and pain. In the liver, you will be having hepatomegaly and jaundice, and in the adrenal gland, you will be having what? In the adrenal gland, tell me in the comment sections, you will be having what? Okay, then you have this small cell carcinoma. In the small cell carcinoma, you have a very famous Cushing syndrome and 𝗖𝗵𝗿. Okay, in the squamous cell carcinoma, you have the hypercalcemia and carcinoid syndrome. Investigations that you will do, the investigations that we will order is firstly the chest X-rays. Firstly the chest X-ray, then we will do the PET scan. In the chest X-ray, you will be able to appreciate solitary pulmonary nodules. In the CT, you will be able to appreciate the staging. What kind of staging is there? And you know what? For the staging, you have the TNM, that is tumor nodules and the metastasis. That is your TNM staging that we do. For the diagnostic procedure, you will do the sputum cytology. If the sputum cytology is positive, it justifies that you are dealing with the case of central tumors, right? Then you will do the thoracocentesis. For the treatment of NSCLC, you will do if it is an early stage. Then you will do the surgery, that is you will do the lobectomy, and the adjuvant therapies that are required, that is your chemotherapy that is required. For SCLC, you will do surgery is not very effective. You will just give the chemotherapy and the radiotherapy. The treatment you will read very beautifully in your pharmacology lectures. That's why I'm not covering the treatment portion and details over here in your pathology. Okay. What is the prognosis? Overall 5-year survival rate is there in 20% of the cases. NSCLC is better prognosis than the SCLC. Okay. And this was all about this chapter of lung tumors. It will be asked as a short note only. Okay. If you are having any sort of doubt, please feel free to reach me. Feel free to DM me. Thank you so much.